Now on Talking Solutions, we've got Linn Billingsley with Kindred Healthcare.
Right.
Also, Rose Davis from the Bureau of Reclamation, a.k.a. Hoover Dam.
Right. We just call ourselves the Hoover Dam people. It's just easier to identify it that way.
That makes sense to people.
I know. It doesn't really roll off the tongue either.
Right.
Actually, we're formed to reclaim the arid West for agriculture by providing water and electricity. It's where reclamation, the word, came from, but it doesn't describe us like some other titles of agencies. So we just, Hoover Dam's mine.
You make it all make sense. I appreciate that. What you've had going on all this past week is National Women's Lung Health Week.
Right. One of the things that the American Lung Association is really big on in this initiative, which is referred to globally as Lung Force, is really about women and lung cancer. People don't realize lung cancer is the #1 killer of women and men across the nation. There really needs to be a huge awareness about it. And so one of the things that we've done this past week is turn Las Vegas turquoise. That is the signature color for Lung Force. And thank you, Rose, for your efforts with the Hoover Dam. And I hope people had a chance to see how beautiful that is when it's turquoise and not just the concrete white. You know, this issue about women and lung cancer is really essential. There are 1,700 Nevadans diagnosed with lung cancer every year. And early detection is so important. Early detection doesn't happen. Less than 20% of people who are victims of lung cancer are detected early. That's pretty small. So we're really trying to encourage people who are at high risk to get screened. But if there is early detection, we have 5 times the survival rates. So just a really top drawer issue and really important to women's health and to all the moms out there who want to make sure their lungs stay healthy.
It makes a huge difference to get early detection.
Yes. Yeah.
In studio with us today, Linn Billingsley with Kindred Healthcare. Also, Rose Davis with the Bureau of Reclamation, a.k.a. Hoover Dam.
You can just call us Reclamation, too.
Okay.
That's easier.
We're talking about National Women's Lung Health Week and what's been going on with Hoover Dam several nights this past week. Coloring it turquoise blue. How massive of a project is that?
Well, the Turquoise Takeover, as we were calling it, is a pretty massive project. Fortunately, we have an excellent technology company that's doing this and doing it very safely. What was really exciting was we were able to invite the public out 2 nights because Hoover Dam is generally closed in the evenings due to security, but with a little bit of begging and a little bit of promising and a lot of support from TST and the American Lung Association, we were able to create a safe environment for folks to come out and view it. When we lit up the dam in turquoise this week, we were really pleased that normally we're closed in the evening hours, but this week on the 9th and the 11th, we were able to add a little extra security and open up the area near the Pat Tillman, Michael Callahan Bridge so that folks could see how beautiful the dam looks in turquoise.
Quite the sight. Lights up social media when something like that happens.
It certainly does, and it's a beautiful shot from the bridge walkway where the public was able to view it. The whole Hoover Dam lit up in turquoise for this great awareness cause.
And is it also correct, Rose, this is not the only landmark that has been colored turquoise for lung health?
There have been landmarks all over the country. This is a nationwide lung force effort and celebrating those that have survived through early detection.
Right.
All over the country, LAX Airport, Freedom Tower in New York City, also famous landmarks such as Chicago's Buckingham Fountain. While those are East Coast, here in the West, we get to celebrate with a beautiful turquoise Hoover Dam.
And the High Roller at the Link went turquoise, too, so that was exciting.
Huge buildings, icons like Hoover Dam are being lit up in turquoise to show solidarity towards early prevention, detection, and support of women's health.
And when we talk about National Women's Lung Health Week, Lynn, it's my understanding that our incidence higher here for a number of reasons. We have a higher percentage of smokers in Nevada. We also have work situations like in casinos where
secondhand
smoking
smoke
is all okay.
Certainly tobacco and smoking put you at risk for lung cancer. But the other thing that's so important about women's lung health and women with lung cancer is that it's not just about smoking. There's a high incidence of people who are diagnosed with lung cancer who have never smoked or not necessarily been exposed to smoke. And one of the things that we're trying to do with Lung Force is take that stigma away from lung cancer. Gosh, I'm really sorry that you have lung cancer, but you were a smoker. First of all, who deserves to have lung cancer? No one. And secondly, having lung cancer does not necessarily mean that you were a smoker or that you were in an environment full of tobacco. So really, yes, there is a cause and effect with tobacco for sure, but there's also a high incidence of lung cancer not related to tobacco products, which is why it's so important for women to be aware that lung cancer can happen to anybody. But when you ask women, top of mind about even cancer cancer awareness. What comes to mind? Only 2% of women would say lung cancer. We would say other female parts.
Sure.
And breast cancer, which is also critically important and important to be aware of. But this is the number one killer, and we really want to get the word out there that people need to be aware that lung cancer exists and there's a high incidence of it, and there's a high mortality rate if it's not caught early. So we want people to be aware.
We talk about early detection being so critical in the survival rate for lung cancer. Screenings, so important for a smoker, for someone who is dealing with passive smoke. But I also think it's quite correct that you bring up people who have never smoked or never been part of those risk factors. Think back a number of years, Christopher Reeve's wife, Dana Reeve, she was never a smoker, but she died of lung cancer.
Right.
So it does happen. Are there any signs, Lynn, that should lead us to go get screened?
When we talk about high-risk screening with the low-dose CAT scanning, that's available now. Even Medicare has approved it for the Medicare population. High risk is definitely around people who have a history of smoking, even if they've quit, if they were smokers in the past and are no longer smoking. That definitely puts people at high risk. But there's also issues around environments that are high in radon or people who have had chronic coughs. You know, I was a nurse, and the first cancer patient I took care of was a woman in Phoenix, Arizona. In her early 40s, she had been a smoker in college, but hadn't smoked since she had children, and she had back pain. She thought she'd pulled a muscle in her back and came in, and they were doing kind of standard x-rays and then an MRI and identified it that way that she had spots on her lung, and she ultimately succumbed to her lung cancer. So it's those kinds of things, chronic coughs, back pain, just feeling a malaise. It's amazing how these things have been identified. So good to be aware, not to ignore those kinds of symptoms.
Absolutely. Awareness. That's what this whole thing with Hoover Dam this past week has been about. Rose, working as you do with Hoover Dam, how does it come up that you decide to turn the whole thing turquoise blue? That is a massive undertaking.
It is a very large undertaking, and it has to be done in consideration with the fact that this is a functioning dam, which means we're delivering water and generating power at the same time as we're seeing about 1 million people a day. So we have some wonderful folks at Hoover that were able to work with TST Technologies and light it up and show the world that we support early detection especially. It's kind of personal to me too, because my supervisor is now on the upside of being a breast cancer survivor. Early detection, no matter what, is very important. So when she asked me if I'd get involved with this and help out Hoover, it was absolutely in honor of her. And of course, she's doing great. It's a huge undertaking, but we've got a lot of great people, and the logistics have worked out very well, and combining a functioning power plant and water delivery system with our security, and very excited to have participated. Turned it turquoise.
You're telling me all the other things that you're doing, and oh, that's right, we've got 1 million people today, and on the side tonight, we think we'll open up and turn it all turquoise.
It was great to be able to open it up in the evening for that beautiful view of the Turquoise Dam, and for people to be able to come up and see Hoover Dam. You never see it like that.
It wasn't the only landmark that was affected by these beautiful turquoise lights, but certainly there couldn't have been any larger landmark.
We're really happy to participate as a local icon, both in travel and tourism, and also stimulating the economy. But places all over the country join forces with LAX Airport, Freedom Tower in New York City, also famous landmarks such as Chicago's Buckingham Fountain. While those are East Coast, here in the West, we get to celebrate with a beautiful turquoise Hoover Dam.
And the high roller at the link went turquoise too, so that was exciting.
They have got the LED lighting. They can go like every color. Turquoise, it's all about women's lung health awareness.
Right.
Mother's Day, rounding out this whole awareness week, we are asking people to get screened.
Yes.
Early detection is always key.
Yep. Talk to your doctor about it. Don't ignore any symptoms you might be having. And then let's just go out and celebrate lung health and lung disease prevention. If you do and you're really participating with your families, or Mother's Day, you're going to go out, show your lung force. We are asking people to post on their social media, hashtag show your lung force. Get your families together, and maybe everybody's out blowing up balloons, or you're out there singing, or maybe you're out playing kazoos, or whatever it might be to show your lung force. Take a video, take a picture, and post it on hashtag show your lung force.
I will also make sure that I've got the hashtag one of those photos of Hoover Dam illuminated in turquoise lighting so beautifully. Links and a podcast of our discussion always goes on the Talking Solutions Facebook page, so people can check that out.
And we would love to see the visitors that went to see Hoover Dam in turquoise. Also, we've got a reclamation Facebook page. We'd love to see all of the selfies and all the folks that took their shots there and helped us celebrate American Women's Lung Health Week.
We'll make sure that is also on the Talking Solutions Facebook page.
I really want to do a shout out to CVS Pharmacies. This past week, they have been asking for donations. They've been a huge national supporter and sponsor for the American Lung Association. All of the dollars go for lung health research and lung disease research. So please support CVS in their efforts to support lung health here in Southern Nevada. I really appreciate that.
CVS has done some really remarkable things because I don't know if people remember, but in the past year, they also pulled out all their cigarettes.
Right.
And that had to be a big profit center for a lot of these drugstores. But they said, how can we sell health if we are not selling health by selling cigarettes?
I'm glad you mentioned that. That was a huge step in the right direction. And it was a big business impact to them. And they took that step anyway because they felt that strongly about supporting lung health. Really cool.
Kudos to CVS. One of the things that we always ask as part of Talking Solutions, what can we as listeners do to help you? Rose, what do you think?
I think that being able to illuminate Hoover in turquoise as part of the turquoise takeover is a way that we can show our support as a government agency to all of health and safety. We're committed to the health and safety of our employees. We're committed to the health and safety of our visitors. As we talk on this Mother's Day, I know I miss my mom and grandma. They've since gone, but I bug my sisters about staying healthy and celebrate the women that I know that are mothers. And this is a good way for me to remind them, too, to get checked, to get screened, and hopefully they will have seen this beautiful sight this week.
Good reminder for all of us. And Rose, just so people know, so they don't go, oh, the government's paying a lot of money to do that light thing. I'm thinking you didn't.
We actually provided funding for the support, which is the security and maintaining the safety of our visitors. And we had to add a little security for the nighttime viewing. But actually, this was from the American Lung Association and donated services through Total Show Technology. We didn't use government funds. It's important to realize that Hoover operates outside of appropriations anyway. It's paid for by the power companies through the electricity we generate. So it doesn't come out of tax dollars at all, except for a few of the support positions.
I didn't know that. Am I missing this information because I haven't been on the tour?
Well, possibly, but it's a lot of things people don't realize. We do an incredibly fantastic job thanks to the power companies that support us in updating our visitor center and being able to do these wonderful things in support of health and safety. And again, that's really important to reclamation is the health and safety of our visitors and our employees.
And people got to come and visit a couple of nights this week when normally after dark they don't.
I know. Everyone was well behaved, and we really are excited about the opportunity. We don't do this for everybody. This is not something we would do for everybody that approached us because it is a lot of work. But in this situation, we were proud to participate, and everything just sort of came together with the talented partners. And we're very pleased that everyone came out and enjoyed it.
On behalf of the American Lung Association, we got to thank you, Rose.
Happy to be a part of it. Thank you very much, too.
Linn Billingsley with Kindred Healthcare and Rose Davis with Reclamation, the Hoover Dam people. Thank you so much for joining us today on Talking Solutions.
Thank you, Terry. Appreciate it.